under the Secretary of Governor. And also a doctor.
No, saya kerja sama luar negeri, Pak.
Oh yeah. He's part of our bureau for the governor and vice governor, working with the foreign country.
The reason that our team would like to visit Jakarta Governor Office today is as our team is universal health problem team. We would like to discuss with you of how we can learn the experience that you have conducted JKS in almost 1 year now, almost 1 year. This experience will be very, very useful for the country because Ministry of Health is planning to launch the national insurance in January 2014. So with that, I think the experience from you will be very useful. We have visited one of the rumah sakit. Tarakan.
Dr. Terioto, are you still in the hospital?
No.
Oh, yeah.
Mereka waktu berkunjung saya masih di Tarakan.
Oh yeah. He's a former doctor in Tarakan. Bagi apa dulu ya?
Yang Pak, yang
Service.
Their hospital, Tarakan, is the best hospital we have. That's why they got medal. Awards from the central government for the Provinsi hospital.
Yeah,
we also become the first province hospital in Indonesia who could do heart injury,
open heart
surgery.
Open heart.
They could do that.
Right.
They're the first.
Yeah.
For the class like RSUD.
Okay.
Yeah, what I could share is about what makes us different with the central government. The first is how to decide who is deserve or the right to use this health card. Central government, but this they have to improve. Maybe 3 or 5 years ago, they used a calorie, how much calorie they consume in a day. If under 2,800 a day, that means they are poor. Or they use $2. Or they use, they made many, $1. Or they use, look at their house, if their floor is a ceramic, or their wall is or they consume fish or meat in the past weeks, or you have motorcycle. We really don't like this method. That's why we again this. I started again this method in 2006 when I was a regent in this place. I said, no. If you ask my people about do you have consumed fish or meat in the past weeks or past, my people will tell you every day we eat fish and meat. Why? We're a fisherman. Just go to the backyard and do it. We could hunt the games in the jungle. That's why we always eat the meat. That's why I don't like that. Another is, you talk about the motorcycle. Some are small scale enterprise. We try to develop more small scale enterprise. But the other side, you rob them become bankrupt when they get sick. Why? When they make a survey, do you have a right or deserve to get this asket skin? They call it asket skin at first. They will say no. Why? Because they own 3 motorcycles. They have a medium store. Maybe they could earn money 1 million a day. That's why they could credit the motorcycle. And when the team come, they said no, they could not have the right. But a couple of days again, when they have an accident or get sick in their family, this store closed. Why? Because they need 30 million, 50 million in the hospital, and they don't have an insurance. The best idea is every citizen have their insurance. That's the best idea. But we have to make them aware first about the importance on the health insurance. That's why the first time for me, I purchase all for you first. I buy for you first this insurance, but not all. That's the first time I have a cooperation with the PT Askes. PT Askes that time is still a business company. They want to take a profit. So I make a deal with them. How we assume I only pay you 50% of my citizen. Because most of them is army, police, a bureaucrat, medium class, maybe people who could purchase their own insurance. So I just pay you 50%. If you agree, we tried it. This is the first time. The whole agency covered by insurance by you. You interest or not. So they interest. That time the government only paid them 5,000 or something. So I asked them, so I pay you this thing. But we couldn't cover the ambulance, bring to Jakarta transport. I said I cover, it's my other budget for ambulance. So we make the deal. So I become the first region in Indonesia who signs a contract with Askes to cover the whole agency. How to know who have the right to go to the hospital to get this insurance? Very easy. I don't need the card, I said. You just need your identity card. So, the entry gate is from Puskesmas. You know Puskesmas?
Yes.
I believe if the rich people don't want to go to the Puskesmas.
Assumption.
So I don't care about you have a motorcycle or have a car. If you credit, maybe you have a car, but you have to pay a lot of money for your children in the university. You don't need not enough money. Your money is very tight. Your liquid is very tight. That's why I don't care. Even you have a big house. Because every house has its own difficulty. And we never know. But when you get sick, very easy. You have to get, your entry gate is from Puskesmas. And when you have to open in the hospital, you go to the subclass. Why subclass? One room at patients until 10.
Yeah.
10 bed and one bathroom. If you afford to pay, you don't want to get to the subclass room. You will prefer a first class or second class or VIP. That's why very easy to differentiate that. So I said, if they want to go to this class, free. And the local parliament has a problem with me. Almost the same. This is the experience to do this. Who against me? The first is the parliament member. You know why? Because before the systems run well, if you get sick, they went to the parliament member, they asked for a capability.
The signature.
When the parliament member give them, they free. That's why this become a bargaining in politics. If you vote for me, I give you your right to the hospital. You tell me. Now you don't need. Even you don't vote for me, you have your right as a citizen. I don't care. Even you don't want to vote for me, I don't care. I just obey the constitution, not constituent. I don't care. Well, this is the problem. So they try to find my weakness. So they use the law. The law said the only poor people could get this facility. But you give to the middle class who own the store, who have a motorcycle. How come if they want to get it? But I said, they are, apa ya, rental itu apa Inggrisnya? Near become poor when they get sick.
Vulnerable.
Yeah.
Vulnerable.
Yeah, vulnerable. This like vulnerable. This very fragile, become poor. So I use this. But they become more rich. I said, okay, if you say like this, that means we never could have a budget for helping this medium-scale business. Which one is more easy? To protect them not become poor when they get sick, this is scale business. Or you develop a new businessman. You give them money, there's nothing to make them become a businessman. I think it's more easy to protect them not become poor than you develop a new businessman. So I said, that's what I choose. And they don't have a word to say to me again. That's why this program ran. But what make the fair in Belitung? And who against us the second? A doctor. And the nurse, they're against this. You know why? You couldn't imagine like this. I increase the salary. They don't care about salary. Like infus, liquid, everything. If they need to buy, they said, I could help you to buy. I could help you. So I told. Maybe they just need 2 bottles. They said 3 bottles. So I keep 1 bottle. Another patient asked again, he sell it to them, including the half. So one of them, I make research, bring home a day $7 until $8 US dollar from helping like this. So you want to help the nurse? You want to increase the salary, become $200 US dollar more? It's cheap. They get this money. Another doctor. Use us, yes. All use the generic, including benang jahit. After the operation, you have to put benang gitu, jahit. Like many give birth after operation. And some of the bad doctors, not all doctors, but some. I like to make a survey on Saturday night, nobody care in the hospital. I visit them. This is another city, because I am the new city. Don't have a good hospital. We have to send to another city. So that's why I have a wedding party, everything, always in the big city. I go to the wedding. So I always stop by in the hospital. I ask him, what's going on with you? They said, the doctor asked me to buy a medicine. If they use his, it could not run well. How much? $400,000, $40, $70. They have money? No, but we're afraid. So I said, where's the doctor? Wow. And they want to, like sue me, they use ED,
Yeah.
The medical institution. They make a protest. Most of them is a member. Some of them is the chairman, they make a protest. I was Puskesmas. Because my brother is a doctor, Puskesmas. And I still a kid. My mom runs a apotheker. Drugstore. My mom. I was standing like a storekeeper. And my mom, we have an assistant apotheker. I always find out the poor people come when they bring prescription. I bring this prescription. Itu apa? Obat apa tuh? Yang nggak boleh makan itu. Antibiotik ya, kalau antibiotik. So expensive. May I buy half? And the assistant apotheker said, no. You have food, have to eat food. It's antibiotic. But the poor people couldn't buy. So what's going on with the hospital with the generic, because this is a pattern, a more high doses. So why they don't get here in this hospital? I try to find out, and I know the problem is. People come, they collect 3,000 rupiah for one entry to hospital. When they give an antibiotic, it should give a 7 day or 5 day. They just give 3 day, 2 day. Why they lack of stock? The problem is they make a report. When the people pay 3,000, let's we say 100 patient care, they just report 30. The 70 is money, keep the pocket, they put it in the locker. So they keep it, they saving this and they could share together. Maybe at the end of the year or at the month, they share. Another for ambulance. It's very funny. I was the local parliament member first. 7 months. My career is too fast. I am not a politician. I just like to do something better, not use my own pocket. I could not help the poor people. That's what my father told me. If we donate $100,000 US to the poor people, if we give $50, we just have 2,000 people. And gone your money. And otherwise you don't have 100,000 US dollars. You don't have the money. If you have, you could not have the whole people. Or village have 9,000 family. You could only have 2,000 family. You could not have every month like that. That's why my father told me, you be a Bupati, a agent. You could have all the whole people. That's what my perception about this. I help the people not use my money. I become rich not because of corruption. Because the government pay me and I pay the people not use my money. This is the system. That's why I like now my brother be a legend in my place. He is also a doctor. A specialist in nutrition from Kubi. He is the head of the, like Ibu did, but he's a kabupaten. The head of a chiefnya. Now they become the president, Dinas Kesehatan. I know about ambulance. Ambulance is very funny in the local parliament. We have, I not forget, I have 8 ambulance. And you know, they said the ambulance, the people have to pay. Because they have a law, ambulance is a PAD, it's an income. So, what's the budget for this income ambulance? $80 a year. Only $80, I use my own pocket, I pay to make all the people free of charge for the ambulance. Because the ambulance they make is like a taxi. People have to pay $15, $20. And when it's broken, we have to use our budget to repair, to maintain. It's crazy. That's the fact. That's why I know the idea. So I said no. Now ambulance free. And ambulance free have another problem too. It is in the local place. You know, hospital very far. Doctors not enough. When have somebody accident, you try to call the ambulance. You know what going on? No fuel. You have to try to find fuel first. Some have fuel, no driver. The driver still fishing. You have to try to find. I said no. Ambulance have to 24 hours. You have to stand by there. I don't care. You have to sleep in the car. I don't care. You have to do this. And when you purchase the ambulance, when you get in, it's like in the ICU units. So I have another problem. They don't have enough doctor. Oxygen have a problem. This is a small place. And we send to the Jakarta, send to RSCM. The family have to breathe. Another problem is this again, okay. Many village people, poor people, they don't have enough money. When you send the sick to the city, they need $5 a day for food, to wait for the sick. The poor people only gets $100 a day for the whole family. Now they have to spend $5 a day. They could not make it. That's really changed the world. So our puskesmas in Indonesia, puskesmas don't have enough.
Impatient.
You could not inpatient. You could not puskesmas. But if you think about poor people, you have to prepare an inpatient in this puskesmas. Each district has this inpatient, so people could come very near. They could go back to their home for dinner, for everything. Could bring the food. That's the idea. And they put the aircon. But Jakarta is very good, very better. Jakarta is very best. Jakarta have bigger than my hospital when I was a lady. But now we have very big hospital. After my brother, a very good hospital, a good doctor now. But we just send to the RSJ. What we need is from internet, from remote, how the doctor to help, like India, you know.
Telemedicine.
Yeah, telemedicine. I think this is a good idea for Indonesia. And now about our KJS in Jakarta. You know what's the problem? You know, this is a case mix. Case mix and fee for service. Very different. We could not apple to compare. You could not do this. That was the problem. That's why we asked the Materi to get in. It's come from hospital. That's what make a protest. We know this is still it's not meet the cost of the real cost. But another problem, our doctor has to learn about the efficiency too. Case mix, you know better than me. Case mix teach the doctor, the nurse, to very strict to use everything and report everything. Why our government prefer the case mix? We call it the INA-CBGs. But here is Malaysia is the DRG, yeah, itu detail related diagnosis, group, diagnosis related group. But because you know why? Because have one doctor make a dissertation, and they report to the patent, and they got this DRG. That's why our government could not use DRG again. That's why we change become CBGs, UK DRG. Malay DRG, what's really different. That's another problem for Indonesia. Maybe the patent is all rights for this patent, right? Could not understand what DRG you need million diagnosed. They don't understand. Only 60 diagnosed, they give it the patent to the one person about DRG. That's why we don't have INA DRG. We have INA CBGs. Cost-based group. That's another problem. And the problem is with our doctor is, we have a hospital. Our hospital is a business unit. We could recruit many doctors. They could decide how much salary for a doctor. Could not control by motive for our hospital. Very big. So I asked, we scope you each year 150 million. Each year. 150 million itu kira-kira 15 million US dollar for one hospital. And they could earn a lot of money. Now they also earn almost the same, 15 million US dollar. The problem is they pay the doctor. That's why I said, excuse me, the specialist doctor, I ask you, in Jakarta, when we got sick, I never hear about somebody recommend me to visit the government hospital. They have a good doctor there. I never hear about that. They recommend me to the private hospital. And this is not the Indonesian healthcare system. Now what's the problem now? If I was rich, I don't believe Indonesia doctor too. Even a private hospital. I go to the Singapore, or Malaysia, or Japan, or German. Even I own a hospital in Indonesia, private hospital I own. I went to the Singapore hospital. You don't believe? Some of the owner of the hospital passed away in the Singapore hospital. Even our government official, many top-ranking official, where they died? Singapore hospital. Suharto is good. He prefer die here. Like Bob Hassan is good. Bob Hassan is very old now, titled. He said, even you said Indonesia doctor is not good, I prefer die in Indonesia. I never go abroad to the hospital. I believe in Indonesia hospital. I believe in Indonesia doctor. It's Bob Hassan. I'm not going there. Hidup dia. Masih sehat. Still healthy. Active. Still got off. More active. And this is another problem. And so, this is the problem for Indonesian doctor now. For the private doctor, the middle class go to the private hospital. It's okay. But for the poor people, middle class, where they go? They go to our province hospital. And what the specialists do now? So what the place for our specialists in our hospital? The middle poor people. And when we make this program, we said you have to go to the subclass. You use a case mix. You could not put the cost fee for service like you want. It's a case mix. And most of them don't agree with this. They feel their salary down, their income down. Why? Because their market is the poor people. The middle class go to the private hospital. The rich one go to the abroad. But only a little middle class go to the not paid hospital. But they still pay. So I challenged them, the doctor. And the first time I have meeting. Now we make a deal. And now if the icon develop a business hospital with the doctor, they only give you 10%, 20% profit sharing. That's the rule in business. Now I challenge all of you. You agree about this, another don't agree. I give you this hospital, become a private, profit sharing 50-50. Bigger than the businessman. I could get many top doctor to join with me, but I don't want to support you again with 15 million US dollars each year. Make a business. You prefer which one? Tell me. No answer. They prefer to be the same. But to be the same, now complain about the salary. They have to set up this. That's why they don't agree about this case mix, and they compare to the like apple to apple with the fee for service. You completely different. And all government has to make this decision. I still in the national parliament. We only passed the law BPJS now, 2011. I still there in the legislation body. I also a secretary in the Kaukus Health Indonesia. I'm the secretary. I'm not a doctor, but now I have an experience when I was a agent. I also not in the health commission. As a commission, we politics. In 2014, we have to do this. That's why we want to make Jakarta as the model. For what the model? To tell the central government, your annual CBD's cost is unreasonable. You know why? This is another problem. This is talking about the ASKES. I tell you, ASKES, the first, before BPJS came out in 2011, is a private, it's a profit center company. That's why when the government paid them use ASKES in 5,000 rupiah per month per day, per man per month, per day, per man per month, 5,000, they try to squeeze this to make the profit. They tried. This could not. They try to make you have to pay by yourself. Finance minister asked them, how much do you need to cover? How much you need for per man per month? Before is 5,000, becomes 7,000. 7,000, you still take a profit, you still enough. They said, no, we need 22,800 rupiah per man per month. $2. Yeah, about $2. And $2 a month. And the Minister for Finance said, how come? How to agree with this? Before you only half, not $1. How come become 3 times? Tell me the truth. They could not have, they don't have data for this. That's why after that, the Minister of Finance, okay, don't need to quarrel, argue again. 2 times I give to you. Fair. That's why come out 14,000, you know. Not enough. 2 times than before. I need 3 times. Tell me, that's the problem. We could not tell the truth now because too many cheating before. You tell the truth, maybe the inspection will come and find out what happened to you. And this become a problem that nobody wants to solve this problem. That's why we said, okay, Jakarta will tell you the truth. Jakarta try first. And Jakarta has another problem too. When they use 5,000 rupiah, Jakarta said it's too cheap, we don't want. We make by our own system. Then guess that. But this own system is fee for service. As much they ask, they pay. This is not a good idea. You never have a medical record. If you put in case me, we have a medical record. You could imagine Indonesia is a big country. Almost 240 million people. You don't have a medical record. It's very difficult to make a decision to what budgeting. That's why you need a medical record. When you talk medical record, you need a case mix system. You have to choose. Nobody agree. We don't care. We have to make a decision. From a health minister, we have to make this decision. Germany, why is good? Because they have a case mix. Why American could not do this? Because too many capitalists, too many traders, too many businessmen don't agree with this. Selling the product. German is good. Singapore is okay. Malay is good. Australia is good. It's 7 years to fight with this. We just begin not until 1 year. That's why I stand firm. I don't care. So I asked the doctor, make a demonstration coming. I asked them, if you're really top doctor, please walk outside, not in my hospital. I don't believe somebody want to use you in their private hospital. If they want to use you, they will pay you, not bigger than our hospital. It's better recruit the new doctor. I tell her this. Even if you don't like me, I don't care. I tell the truth. I just tell you, please, the third class, use this case. When the first, second, or VIP, you take it. But the problem, the VIP is not take a lot of money. The portion share, market share is here. That's not the problem. That's why I want to make now, okay? Please better make the law. What is the reasonable take-home pay for the doctor? We don't want doctors very difficult, have to study hard, spend a lot of money. If they earn cheaper than our bus driver, is easy for them. Our bus driver is almost $800, $700 a month. 3.5 for our basic salary. How come a doctor only 1.8 times from basic salary? That's what the Minister of Health give them. So we increase the salary. We put another model. And we hope the province hospital have the one standard. Now, each hospital different salary. And we want to make this Tarakan as a model. That's why we choose Materi in this insurance company. For 1 day, the citizens of Jakarta have to pay for their training each month. They have no money, then they could top up. If they feel, I want to get in the first class, so maybe you have to pay $6, not $2. You have to pay by yourself. If you don't have no money, I pay for you. the government pay for it. When you have enough money, you pay for yourself. So we want to make this, we have our own bank, so each citizen, when they got this identity card, their identity card is there also automatic teller receipt. And this is very important. When the single digits come out, we could do this. Where? So the poor people use our budget. Now another problem with the central government. Central government is too low, the standard. You know why? Because they use the average cost of the whole Indonesia. Like in my hospital before, in Regency Belitung. When you have a complication, only one doctor visit you. One doctor. And there are no lab, no machine, it's just feeling. Yeah, so the cost is cheap. But when you go to Jakarta, oh, you didn't go to this room, go to the hospital, doctor visit, that's what cost is different. Jakarta is different. You could imagine when they put this inner CBD's cost, they use average the whole Indonesia without private hospital cost and without Jakarta hospital cost, because Jakarta don't want to join. And they put this cost now to pay us. That's why no private hospital really like to do this. What we little bit step there, to push them to join. But the governor, Mr. Governor's dream is the whole hospital in Jakarta the same. They could get the same. And that's why we want to make, maybe we call it like Dr. Perito said, this is not inner CBGs, but Jakarta CBGs. To make a comparison, if Jakarta could going well, that means another hospital could better. Yes, now we are on the progress, bagi dikerjain kos-kos itu, harga-harga itu, we want to make this. And another problem is the central government, they use 75% only from the total cost to use the cost. Because why? They said from central government paying me is not enough. So they just pay them 75%. That's what a little bit problem. The first, doctor don't like to use the casemates. They're usually inefficient, usually don't really strict on the procedure. Now they have to do this strict on the procedure and this have to use very efficient and make the record, medical record. This is also a difficulty for him, for her, the doctor. Another is the government payment only 75% from 100. Even you use 100% cost, not yet enough. Because the average use the regional and local cost. That's why we want to improve this. This becomes the duty of Dr. Terioto. But he also have to do this very wise. You know why? Because you could not, it's like in inner CBGs. Inner CBGs is only this. You couldn't, casement is like this. Doctor have to be efficient. But it's too small. We have to make this increase. But the increase of the area not mean this area is because the inefficient of the doctor, but have to be a real cost. The inefficient doctor, you have to out from our system. But we have to make this bigger casement, that's right. But we don't make this suitable for your inefficient. If the right price is here, your inefficient is there, we don't want to make this cost to cover your inefficient. That's what Dr. Terry has to understand about this. Very fair, because this is people's money. And we don't want to make this fair. If Jakarta fair, that means the whole Indonesia there is no hope. And the parliament won't bring me to jail. They said, I very unprocedural to point us as the operator to do this project. I said, I have a law. And some of the people they said, they make a contract. What the best, basic law for this contract, they said, this is ordered by by the vice governor and the disposition from the vice governor. And they make this copy, they bring to these corruption wards. They accuse me corruption to give to the askers without bidding. This is politics. I said I prefer go to the jail when I do this because for the nation's sake, not for me. I will talk about corruption. I will ask you to find out all the government officials, compare their tax, income tax, their lifestyle, and their treasure. If not suitable, not fixed, they are corrupt. You please find out first. I don't care. That's not the problem in Indonesia. Too many vested interests, especially for the parliament member. You become very powerful. People come to you, you constitute, you make a return, so you could pay everything. Even they go to the private hospital, not in the third class, the first class or the VIP, when they feel this pity, want to spend a lot of money, they just ask for the parliament member that could pay for them. How come? We said no. Even we find out Hearts Hospital, the professor told me, from Lampung, another province in Sumatra, come, they go to the surgery, heart surgery, have to pay 150 million rupiah, 15 US dollars. How to do that? They have a broker to tell you, don't worry. We could try to help you use the Jakarta card. We could provide you a new identity card. You just give me 20 million, $2,000. If you become a sick man, you think, I spend 15,000 US dollars or just 2,000 US dollars, and pay 2,000 US dollars. You know what's going on? This is Sleepy. Sleepy Hospital have a twin tower hotel. The family of the 6 men use our card and stay in the hotel. That's the problem. That's the past problem. We said no. Another problem in the past time, you need a letter to say, to make a requirement that you are a poor people. We call SKTM, Surat Keterangan Tidak Mampu. It's like a letter to tell you are not afford to pay the hospital. So everybody had this letter. And because everybody had this letter, the doctor make a program like this. When somebody is sick, they give them a prescription. They look at, if they afford, they will buy the medicine. If they don't have afford, tomorrow that we know he's not to pay. But too many die because of this. You have to try. Too easy. Or too many people, how about if you get sick at Friday night? Saturday, Monday, Sunday, no government office open. You have to wait in your home. That's why many people die in their home. Now he said, no, this is SKTM anymore. If you get sick, you just go to the Puskesmas. If they refer you to the hospital, Sekat free. We don't care. But if you go to the private hospital first, and in the middle you said, I need the money, please help us, we said no. If you realize you not enough, not have a fund to pay the hospital, you better go to the Sekat. That's what we make this rule. But now the life problem in this program is only about the cost. Because we could not meet the cost of the real hospital. But that's why we have to very wise and very careful to make this case mix cost the real cost. We compare from the private hospital, from our hospital, so we have to make this efforts. We have to make our own JAK CBDs first. And we hope the central government will know about this program. I have met the minister, they realize they have a program with the 75% only, and they never put the Jakarta hospital for this efforts cost. That's not a problem. And that's all I could tell. Maybe you have something to add, Materi or who did? Yeah. I'm really concerned about this program. That's why I learned many from the doctor. Sometimes I went to the doctor's home to talk with them, go hospital, private talk with them. That's why I know the program. Talk with my brother, the system, from my experience, from what I know. And another dream is we want one doctor care for 3,000 residents. That's why I think we could do this because Jakarta is different. It's my village. Because Jakarta, the population is very big, concentrated in one place. If we have to go very far, find 3,000 people, the whole district is a problem for you. But if you stay in one area, it's so easy. So every doctor is like have their insurance, health insurance company. Next year we hope we could. And next year we hope we could try another social security for pension fund, for retired person. The central government will do this in the next year, 2015. But we hope we could try it again, 2004.
Now, Basuki, I think time is running, but I just want to say that the story that you tell us is very interesting and very lively, and I don't think that we can read it from anywhere. It's from the real experience. So, what I try to request from you maybe 2-3 things. First, we would like to request that we would like to learn more of the system.
Yeah, I think,
so we would like to meet what is the party name again? Ryoto. So we will come back to Ryoto to discuss more because I think.
You moved to your office?
No.
Sorry, not yet.
So you're still at Tarakan.
Still?
No. It's still at Thinkers.
Okay, so we will find.
Give a cell phone number.
Yes.
It's more easy.
So ask for your permission to do this. Secondly, I don't know whether after 1 year, a focus assessment may be useful to learn what is the challenge, what is the achievement that we received so far, and try to make it as a lesson learned.
I think Jam case they have to prepare this with the DIN case.
So
people will know.
We can work together as a is an expert in this. He has seen so many models in the world. So we can frame this better in terms of assessment. And we would like to document.
I think, sir, excuse me, I think we invite Mr. Robert, yes? We could have an office in this Jam case. Even if we move to a new office, there's many space. Yeah, you is. Yeah, WS could stay there, so you monitor from day to day what the problem. What the argument about this, what the complaint, everything. From the doctor, putting buka aja begini. And then the process, you just come, you stay there, you will see what happens.
This go to be true.
Yeah, give you not a room maybe, a sit table.
We've got a laptop.
Yeah, just go there, try it. Then you can pengalaman. So it could help us.
Okay.
I think more easy to the report just there. And the one advantage is you could have the nation.
I'm not quickly.
Yeah, very fast.
Okay, I think that will be very useful to us. I think it also will be useful to the healthcare system for Indonesia in general as well.
Yes, we hope. Thank you for your help. Our country, especially in Jakarta.
Can I just pick that as well? Because I really specialise in this area of health financing and advising governments on how to finance their health systems. And we in the WHO, as the WHO has been saying, are very keen on the side of universal health coverage, where everyone gets the health service they need, but don't get bankrupted when they do so. So we've been fascinated with what you've been doing here in Jakarta, and I must say that we're convinced that what you're doing is the right thing. Absolutely convinced. And I've studied systems in Africa, Asia, and what you're doing by identifying, just saying that the rich will tend to use the private hospitals, and you're trying to provide a system where there's a universal entitlement that people want to go and can, get free healthcare using a card at the public facilities. That system is working very well in Malaysia, in Thailand, in Sri Lanka, and in Mexico and Brazil. Lots of middle-income countries are recognising that this is the way forward. I think it has been a concern, and slightly off the record now, maybe the path that Indonesia has been taking recently, and this may be coming from the Ministry of Finance, is they're not putting enough public money into that system. They're putting too much burden on the households. So therefore, the plan that has been envisaged, I think in our opinion, but also my bosses in Geneva, isn't going to work. But I think your system will. I'm convinced your system will, but it will need potentially more financing from the government. Now, without getting too controversial here, we're very aware it's an election year next year in Indonesia, and I studied all these systems across the world. I think that it would be just great if this system were rolled out across Indonesia. And it would cost about 1% of GDP. The World Bank would cost this. It would cost about $8 billion a year to do this. But there is the money in central government to do that. There is money in the budget to do that. It's obviously going to take very strong political leadership, who I'm referring to, to really, sort of push this as a national policy. Now, we are very keen, as Dr. Kanchik was saying, to support what you're doing here, to understand how it's working, to help you make it work better here. But beyond that, we're very keen to promote what you're doing on a national scale. I'm fulfilling this role with the government of India at the moment, and in Myanmar with Aung San Suu Kyi, who's likely to form the next government in 2015. This is inherently political. You know all the politics, the politics of the medical profession fighting back on this. We can help you with these battles, and so I, in particular, I'm a sort of a political health economist, and my background is as a manager of hospitals, actually, in the British system. So we would very much like to help you in your efforts, and maybe slightly under the radar in doing this, sort of helping you sort of sell this on a national scale. And we would be just delighted to help you do this.
I think we have to help us to what formula, how much the cost for per man for the Jakarta. So after that we have to ask them to pay for this premium, a premium for per man. That's very important. So after this bisa dihitung. Kelas 2, kelas 1 berapa? Sehingga kelas 2, kelas 1 kita bisa perlu juga. Yang para pegawai gitu, yang VIP kita berapa? Itu kan konglomerat kan. Jadi orang bayar premiumnya berapa bisa dapat berapa. Jadi jam kes harus bisa rumuskan itu loh. Karena jam kes dari jalur perda itu adalah asuransi seperti itu. Ya,
The lesson learned for me today is first, it is the strongest political will that we can find. Second, you make very complicated things simple. Instead of having too many exceptions, you try to avoid those exceptions, get it under one umbrella, take it simple. And the third thing, I think, is your negotiating skill, I think, is one of the best. You go to SKS and give a big deal. This is a big deal.
Now it's online. If they put if just to make synergies or system. Now we have online because ASKES only after 2 months they finish it. If we want to use this technology, it's too expensive and too long. But this is a national system.
Yeah. We have to utilize the existing system.
But I am danger go to the jail because of this. So I want to put in in jail.
But really where the big negotiation needs to happen is with the Ministry of Finance, because if you look at where Indonesia is internationally, it's only spending about 1.2% of GDP in public health financing. Now that's very low. I mean, it's really down with India and Pakistan and countries like this. Your neighbours that are doing better, Malaysia and Sri Lanka and all these countries, are spending at least 2% of GDP. The Chinese government have just put $160 billion into their health system to then now nearly 3% of GDP. So really, I think the message that the Ministry of Finance need to understand is that if you are to have a good health system and are to protect, just like it's suggesting, protect the population, basically the government needs to double public health spending over, say, 5 years or so. Now that is feasible, but obviously it's going to take a lot of persuading of the Ministry of Finance to do that. And you feel at the moment that the Ministry of Health isn't so strong to be able to argue that case. But then in a new sort of political environment, maybe finance will get it, that it needs to basically double spending. And again, we can help you and some people you're working with articulate that case.
I think the youngest does. The important is you have to listen, to tell the parliament member, and have a calculation. Not like that, just 1-3 times. What's your calculation? Don't have a record. That's the problem. That's what we want. Okay, thank you very much.
Okay. Thank you.
Can I just give you some briefing? There's something of interest for you there. Let's walk off the go.
Thank you. To go outside have
Must be many. Many more meetings to go.
Like to meet you.
Thank you. We'll come back.
Long enough, so you will know the whole story.
Thanks for actually giving me the opportunity to use your hobbies.
Yeah, I tell you
Thank you.
But I think we need to send the cell phone number.
Yes.